Knock, knock, knock.
Hello.
Hi, Mary. My name is Margaret Sheehan. I'm one of the nurse practitioner students. I'm going to be working with you today. It's so nice to meet you.
Good to meet you.
Is it okay if I call you Mary, or should I refer?
Yes, Mary is perfect.
Okay, great. Can you just confirm your date of birth and your last name for me,
Sure.
please?
My last name is Burris, and I was born September 15th, 1951.
Okay. So you are here today for your well visit or your preventive visit at your primary care provider. And basically this appointment will just go over any concerns you have, review your medical history, surgical, hospitalizations, family, that kind of thing. Do just a quick run through, review of systems, and then I'll do a physical exam.
Okay.
Okay. Is there anything today that you have on your mind as a concern or a goal for your health care?
Well, I was recently diagnosed with mold sensitivity because we found we have mold in our house, so we're working on the remediation, and I'm working on supplements to get rid of it, and hopefully we'll feel better after that.
Okay, so kind of on the front end, not quite completing the process, so
Right.
maybe not getting as much relief yet until that process.
Right.
But you feel like you have the people you need in place to help you
Yes.
with all of this.
Yes, I have some good people.
Great. And then you could teach a class for the rest of us who don't know a lot about it, right? Okay. And then if you could just go over any past diagnoses that you've received.
Okay. I had diagnosed with Hashimoto's, osteopenia, osteoarthritis, chronic fatigue from Epstein-Barr virus. What else? Am I missing anything? Fibromyalgia. AFib.
Okay.
Mm-hmm.
Okay. And then I noticed too in your charts that you have thalassemia.
Yes.
Is that minor or major?
Minor.
Okay.
Mm-hmm.
All right. Well, let's just briefly go through all of those. The mold, it sounds like it's being handled, and you're working with someone that's helping you with that. When were you diagnosed with Hashimoto's?
Over 30 years ago. It's been quite a while.
Okay. And do you take replacement for that?
I take Armour Thyroid.
Okay. And that dose, has it remained the same pretty much for a while?
Yes.
And you're happy? You don't feel like you're having symptoms or anything
No.
like that? Okay. And then the osteopenia, you had a DEXA scan recently, or?
A couple of years ago, yes, and it was just starting osteopenia, so I started lifting weights to try and avoid taking any more medication. So.
Great. Great. That's wonderful. Okay. And then the osteoarthritis, when did that become an issue for you?
That was maybe 40 years ago, long time ago. Always had arthritis.
Okay. And is it hips, knees, shoulders, hands, where are you having issues?
Mostly my hands. I've had cysts removed from my hands and my spine. Had spine surgery 2 years ago from the arthritis. My shoulders ache. I think it's from the arthritis.
Okay. Okay. And no joint that's really causing problems right now, or?
Just my left shoulder. Gonna get that checked out.
Okay, good. Okay. And then the thalassemia, when were you diagnosed with that?
Oh boy. When I was first pregnant with my first child, 45 years ago.
Okay. And have you had any issues with iron overload or having to have chelation?
No.
Have you ever had to have a transfusion?
No.
Okay, so you just keep kind of tabs on your iron when you go to see the doctor.
Right.
And do you supplement for that? Or?
I don't take any supplement for that.
Okay. All right. And then the chronic fatigue and fibromyalgia. Has that changed at all since you were diagnosed?
The best thing that happened was I started taking low-dose naltrexone about 2.5-3 years ago, and that really kept me from crashing. I would crash all the time if I did too much.
Okay.
I would be down for days, weeks, months.
Oh boy.
And so the low-dose naltrexone really helps me function like a normal person.
Wow, so it's modulating your immune system's response to that stressor.
Yes.
Whatever that is.
Yeah.
Well, that's wonderful, because it must be a challenge to kind of figure out what activity level
Yes.
you can handle.
Yeah, it's always
day to day.
Yes,
Kind
it's
of a
always been a
guessing game.
challenge, right?
Well, good.
Mhm.
And no real side effects from the
No,
LDN. You
no.
found your sweet spot.
Yeah.
with the dose and everything.
Mhm.
Okay, perfect. And then any hospitalizations or past surgeries?
I've had 9 hand surgeries for trigger fingers, 2 carpal tunnel surgeries. I had a surgery to remove a cyst from my spine about 2 years ago, and a torn meniscus surgery.
Was that an injury related?
Mm-hmm,
Okay.
injury related. That's pretty much my surgery. Oh, hospitalization 5 years ago when I got COVID. I started AFib, so I was and I had pneumonia, so I was in the hospital for that.
Okay.
Mm-hmm.
And is AFib something that is now chronic and you take medication
Yes.
for?
Yes.
Okay. Any emergency room visits or hospitalizations for the AFib since the COVID?
Not emergency room.
Maybe just with your doctor.
Yeah,
Or
more just calling the doctor, and
Okay.
he gives me Flecainate. Take Flecainate if I go into it,
Okay.
and
So
it usually helps.
got it. So when you have runs and your
Mhm.
normal medication isn't cutting it, you take the Flecainate,
Mm-hmm.
and then
Mhm.
that's always brought you out of
Yes.
it. So you haven't had to have an ablation or been
No,
converted or
right. I was close to it. I was in AFib for 3 days. I was going to have an ablation, then I came down. So, thank goodness.
Yeah.
Yeah.
That's nice. You dodged
Mhm.
that.
Mm-hmm.
Very good. Okay. So it sounds like a lot of your diagnoses no longer trouble you. So you've got the chronic fatigue and the fibromyalgia that's kind of handled with the
Mhm.
LDN. You've got the Hashimoto's, but you're stable there. Do you get an ultrasound of your thyroid routinely?
Yes, once a year I do.
Any nodules or goiter?
I do have nodules, but they've maintained the same size.
Okay.
No
And-
goiters.
Okay, great. And the osteopenia you've addressed, and I'm assuming you'll have another DEXA scan at some point to
Yeah.
make sure that
Mm-hmm.
things have either improved or at
Mhm.
least haven't gotten any worse with your weightlifting. So that's good.
Yeah.
And then the osteoarthritis you're dealing with, you're going to have your shoulder looked at.
Mm-hmm.
And then the AFib's been good for a while now.
Mm-hmm.
That's good. Okay. And then how about your family history? How about siblings or your parents? What kind of diagnoses did they have?
Okay, so my father had congestive heart failure and COPD, and that's pretty much what he died from. He also had thalassemia minor. My mom and he died at 86. My mom had, she was a drinker and a smoker quite a bit, and she had latent diabetes and died after surgery. They were going to fix a sore in her foot, and they went in to fix something in her heart, and she died shortly after that at 79.
Okay, and then how about siblings? Any major health issues?
7 siblings. 4 of the other siblings have AFib. One brother has thyroid, one sister has thyroid, and she also has dermatomyositis. And the brother that has the thyroid and the heart also has some autoimmune issues that are just kind of coming to fruition now.
Okay.
And I think he has detached retina.
Okay.
So, but the other 2 brothers have, I think I said they AFib, right?
Yes.
So, okay.
Yeah. Okay.
Other than that, pretty good.
Okay. And then you gave me a list of your medications, so we'll look at that.
Okay.
And sounds like at the end of the appointment we'll arrange for some labs. We probably need to do some inflammation markers, thyroid, just check on all of those things that you normally get. What about cancer screening. Have you had a mammogram recently? Have you had a colonoscopy?
I had a colonoscopy about 2 years ago.
That was good.
I had a mammogram last year, so I'm due for one, but I'm going to get an ultrasound this year.
Okay.
Um,
And never any issues with either
No.
of those? Okay,
Mm-mm.
good.
mm-mm.
And you see your dermatologist
Mhm.
regularly. Have you had any issues with skin cancer?
No, I have not.
Excellent.
Yeah.
Okay. And then how about gynae visits? Are you kind of no longer doing that, or are you still seeing a gynae?
Right. My gyno kind of retired, and I haven't been back in 2 years. Although last year my internist did a PAP, and that did turn out fine.
Okay. So never any issues with HPV?
No. Mm-mm.
Okay. Perfect. And then as far as your OB history, you have children?
2 children.
Okay. And were those vaginal, C-section?
Vaginal.
Okay. And any issues with postpartum depression or anything like
No.
that? No. Nice. And then, let's see, we talked about your medications. What else do we need to talk about? Any issues with depression, anxiety, concerns about your cognitive function?
Not really. Anxiety from this mold. I think I tend to be anxious. So just trying to calm myself down from that. But other than that, that's about it.
What I would like to see is if, when all of this is resolved, if that anxiety dissipates, that would be, situationally, you have concerns about how all this is going to work out. But if you continue to have anxiety or symptoms that are bothersome, it maybe be worth looking at. Okay. And then your activities of daily living, you don't feel restricted or you've had to change things. You're still active and exercising. And, and how's your diet? You eating well?
Good. I eat really healthy. I'm gluten-free, dairy-free, soy-free. That's my thing. So I eat pretty good for the most part. I cheat once in a while. So other than that, I'm pretty good.
Okay. And you live with your husband?
Yes.
Okay. And you feel supported?
Very much.
Okay. And let's see, what else do I want to ask you? Any issues with driving?
I don't like driving at night because I have a little glaucoma, and it's a little, hazy at night.
Gotcha.
So
that's smart.
I don't drive unless I have to.
Okay.
Yeah.
All right. And anything? Have you gotten to the point where you have advanced directives or health proxy or anything like that?
We have a what do you call it? A will. Living will.
Okay.
Living will. Yeah.
Okay. But you're managing your health concerns, so you haven't gone to like designating anyone outside you or your husband as a health proxy.
Right.
Okay, perfect. All right, I think we covered all of that. So I'm just going to ask you some questions, kind of head to toe, if you've been dealing with any symptoms that might kind of clue us into an underlying issue that we need to look at.
Okay.
Any problems with headache, brain fog, dizziness, fever?
No.
Any vision changes or hearing changes?
No.
Any unexplained weight loss?
No.
Okay. Any sore throat, runny nose?
No.
Okay. Any issues with swallowing?
No.
Any palpitations, chest pain?
No.
Do you get short of breath when you walk upstairs or
No.
do your exercises?
No.
Okay. Any numbness or tingling in your fingers or toes?
No.
Any color changes in your fingers or toes? Any
No.
duskiness, blue? Or,
Mm-mm.
okay. Any issues with wheezing or anything
No.
like that? Great. Okay. Any digestion issues, constipation, diarrhea, abdominal pain, jaundice?
No.
Any urinary incontinence or leaking?
No.
What else do I need to ask you? How about sexual health? Are you happy with your sexual health or any concerns?
Yes, no concerns.
Good. No vaginal dryness, no UTIs?
I have vaginal dryness. Yeah, no UTIs though.
Okay. Do you do anything for that? Have you ever
I-
tried estrogen suppositories?
I haven't. No.
Okay. As we age, because our estrogen goes down naturally, just as part of aging, those tissues are not as plump and perfused with blood like they would be if we were 25 and our estrogen was great. So there's really no risk to using topical. And let's say you have sex, once a week, you can insert an estrogen suppository, and that will help with that vaginal dryness. It's one option. I mean, you can use lubricants and things like that too.
Okay.
But if it is a problem for you,
Yeah.
they also treat women with chronic UTIs because it's related. That's why we ask about if you have problems with urinary tract infections, which as we age, a lot of women do deal with that.
Yeah.
Okay, but you don't have any of those issues. We already talked a lot about your mobility and we talked about your pain as well. So I think we might have covered most everything. So I'll go ahead and do the physical exam.
Okay.
Kind of we'll go head to toe as well. So I'm first going to feel your scalp.
Okay.
See if you have any bumps or tenderness. You told me that you're seeing your dermatologist, so that's good. I don't see anything there. If you wouldn't mind taking your glasses off. Can you raise your eyebrows for me? Can you scrunch your eyes closed? Can you smile real big? Can you frown? Okay. Just let me know if you want to close your eyes if you feel the same on both sides. Okay, it's very even for you. Okay, perfect. And then I'm going to have you follow this pen light just so I can see how your eyes move. Keep your head still and just follow with your eyes. Perfect. Okay, got it. I'm just going to shine a light in your eye. See how your pupils react. All right, very normal, good. And then I'm just gonna look in your eyes and your ears real quick. I'm gonna start with your ears. And let me know if anything is tender or hurts. It shouldn't. We're just looking for drainage, redness, anything that would maybe let us know that you have an ear infection. Or any buildup of wax, which I do not see. Okay. I'm just going to look at your eyes. And do you see your eye doctor routinely?
Yes, once a year.
Perfect. You are very good, compliant patient. Okay, just look straight ahead for me. And then I'm just gonna feel your lymph nodes to make sure there's no tenderness or swelling. And I'm just gonna feel your thyroid. Okay, perfect. And none of that hurts for you, right?
Right.
Okay. If you want to just grab your water.
Okay.
If you can turn to the side, I'm just gonna feel your thyroid.
Okay.
From the behind. Okay, great. And then if you want to take a sip of water, hold it in your mouth. Okay, and then if you could swallow for me. Perfect, I can put that back for you. Okay, and then I'm going to listen to your heart. And you can just breathe normally. Just gonna feel your pulses. All right, I'm gonna listen to your lungs. You can just take a deep breath in and out through your mouth. And I'm going to have you lay back down. And if you were in a gown, I would raise your gown to be able to appreciate your abdomen a little bit better. I'm going to go ahead and listen to your bowel sounds. Okay, and then I'm just going to feel a little bit on your abdomen. Any tenderness?
Mm-mm.
Okay, and then if you could just take a deep breath for me and exhale. Can you do the same? Okay. I'm just going to feel underneath. Okay, perfect. And then you can go ahead and, actually I want to feel for any edema. Your lower extremities. And you had said it's the left foot that's swollen from the surgery?
Right.
Okay.
From dropping breadboard.
Isn't it funny how we have accidents that create problems for us?
Yes.
Your pulses are good, no swelling in your legs.
Good.
If you want to go ahead and sit back up.
Okay.
I'm just going to take a peek at your range of motion.
Okay.
Don't do anything that hurts, but if you can raise your hands above your head. And you're kind of restricted. That's about as far as you can go on both sides, or is your right better than your left?
The right's better than the left.
Okay, perfect. And then I'm just going to check your strength. If you can put your hands out like this. And then just resist
So like this?
pushing you down.
Okay.
Yeah, okay, perfect. And then if you can go like this, and then pull, resist. Okay, and then if you want to put your wrists like that, same. Okay, perfect. And then if you can lift each of your legs, no problems there. Can you extend both legs and move your ankles? Okay, and then I'm just going to check your strength. You can put them back down. Just lift your leg against. Perfect. Oh yeah, the weights are definitely working. Push your leg out. Okay, push this one out. Okay, and then same with your feet. Raise your feet. Perfect. Okay, and then we're just going to do quick reflexes.
Okay.
Because we're not in an office where I can have you dangle your feet. We're a little restricted, but. But what I would do is I would feel underneath the knee, and we'd do your reflexes there.
Okay.
I think that's about it. That's about it.
Okay.
I think. Anything that we didn't touch on?
No, I think we got everything.
Okay, so what I'm going to do is I'm going to send you some information through the patient portal about the estrogen suppositories if you're interested in that.
Okay.
And then I'll also order some labs just to repeat your TSH, your T4, your T3, and some of your inflammation markers, just basic labs. And then once I get those back, we can do telehealth. Maybe in 2 weeks, just to review those to make sure that everything's good. But if you have any concerns or questions, just let me know.
Okay.
And then when you see your shoulder doc, if you wouldn't mind having them send any results or changes in your care to us so we can update your chart, that would be great.
Okay.
Okay.
Sounds
It
good.
was awesome meeting you. Thank you so much.
Thank you.
All right.
Thank
Have a great day.
You too.